I'm going to start now. Good evening, ladies and gentlemen. My name is Lelia Khan, and
Good evening.
I welcome everybody to this webinar this evening, which is about the power of nurses of color and recognizing your leadership potential. Before we start this evening, I just want to go through some housekeeping with you. And could you just keep your phone on mute, please? Your device on mute, please, so that we don't want any interruption during this program. Also, questions will be asked after the presentation, and you can use the chat box as you will. If there's any question, put your questions in the chat box, or if there's any query. And at the end of this program, we're going to be having some evaluations, which we will appreciate if you fill for us. So first of all, I'll just go through the agenda. Okay, so what we're going to be talking about today, this is the agenda. I've done a bit of introduction there, but I'll still go through the slides and introduce myself and the speakers that's going to be speaking today. So we'll just give you a bit of overview about C3. C3 is the charity organization that arranged this program webinar tonight. So I'll give you a bit of overview about C3, and we'll have a leadership presentation by Vinice Thomas, and we have the community nurses engagement, and one of the nurses will give a feedback on the engagement. Then we that will lead us to questions and answers and closing remarks. So that's just a brief agenda for today's webinar. So the speakers for today, we have Vinice Thomas. She's the Director of Nursing and Quality, Professional and System Leadership, and the Chief Nursing Officer. She's the Chief Nursing Officer for Black Minority Ethnic Strategic Advisory Group in the London region with NHS England. We have a nurse, Lelia Khan. She's a registered mental health nurse and a registered Black Flower Remedy practitioners, health and well-being practitioner, and she's a mental health trainer. And you have me as well, who's involved in this program. I'm a registered nurse. I'm a specialist nurse practitioner. I'm a trainer, a project manager, a Queen's nurse, and a chartered manager. So, who is C3 and what is C3 all about? C3 is a charity organization, which is called C3 Collaborating for Health. And the ethos of C3 is about a world where no one dies of preventable chronic diseases. So our mission is, C3 is a global health charity that brings together different communities across sectors to create changes and make it easier for people to stop using tobacco, to improve what they eat and drink, and do more physical activities. So what do we mean by non-communicable diseases? These are some key facts about it. Non-communicable diseases is also known as chronic diseases or long-term conditions, such as type 2 diabetes, cardiovascular disease, and some cancers, which is accountable for 3/3 of global death every year. Tobacco use, poor diet, harmful use of alcohol, and lack of physical activities are the leading risk factors of non-communicable diseases. Approximately 80% of type 2 diabetes, heart disease, and stroke cases, and 40% of some of cancer cases are preventable. And this is quite important for us to know that these are conditions that is preventable, but it's quite prevalent at this right moment. So what makes us healthy? Many factors contribute to our health, including our genetics, our behavior. When we talk about behavior, it's lifestyle behavior. What do we eat? Smoking, physical activities, housing, transport, and the neighborhood we live in. The social, economic, and environmental factors, which are the social determinants of health, also can contribute more to our health than healthcare. Our work in C3. As healthcare professionals are among those placed to give trusted advice needed to people to live healthier lives and prevent chronic diseases. C3 works with healthcare professionals, particularly nurses. And as you can see in my introduction, I'm a nurse. And what do we do to enhance our own knowledge and become advocate for patients, for the families, and the community we live in? C3 is also involved in international seminars. Global experts present innovative approach in preventing chronic diseases and promoting health from around the world, Ghana, Kenya, in Africa, and some places like India. So we work with Institute for Global Health, Oxford University, the Public Health Foundation of India, and Harvard University. Also, with C3, we talk about oral health. Our mouth is the gateway to our health. C3 is partnering with Colgate, the International Council of Nurses, Commonwealth Nurses, and Midwife Federation, the World Continuing Education Alliance, and a cohort of global nurses to raise awareness of the importance of oral health in tackling non-communicable diseases. And to put things into context, ethnic inequality in health outcomes are evidenced at every level throughout the life course of individual, from birth until death. In the NHS workforce, Black and Asian staff represent only 21%, but early analysis showed that they are accounted for 63% of deaths among health and social care professionals in the first wave of the COVID pandemic. It is therefore crucial to place ethnic inequality in healthcare within broader context that acknowledges outcome both within and beyond the healthcare system. So there's some staggering facts that we need to consider. In Britain today, South Asians have 40% higher death rate from coronary heart disease than the general population. Black people are 4 times as likely as white people to die of coronavirus earlier in the pandemic. Black Africans and Black Caribbean people are over 8 times more likely to be subjected to community treatment orders than white people. Black women are 4 times more likely than white women to die in pregnancy or childbirth in the UK. So tackling inequalities. Nursing for Healthier Community, which is the project that brought this program to light today, works with nurses of Black, Asian, and ethnic minority heritage who can reach out to their local communities with the professional skills and cultural understanding that will help to improve the health outcome of the population. And this project was funded by Budget Trust in 2020, and this is the 3rd and final year of the project. And what is the aim of the project is to work with nurses from the minority group in Brent, Harrow, and Ealing. Why that area? It's happened in that area because that area had a large percentage of patients that died during the first wave of COVID. And that's the reason why Budget sponsored this initiative. And the group of nurses, why are we working with this group of nurses? We're working with them to create a dedicated peer support of network of nurses who will learn new skills and go and share these skills with their local community they work with, and helping their members of the community understand the health risk and they should be able to protect themselves from complications of COVID and other long-term conditions. So the Nurses for Healthier Community activity up to date. When we started this program, we started with a working group. We had a working group to advise us on the group of nurses that we need to work with. As we all are aware that nurses are in different categories. We have the mental health nurses, learning disability nurses, we have the midwives, we have the general nurses. So we had to work with the advisory group to give us advice on the group, the caliber of nurses we need to work with. And not only that, we were looking at, we work with community nurses, hospital nurses, or practice nurses. So that is why we had the advisory group. And working with the advisory group gave us a bit of light to the type of nurses we're going to be dealing with. Then we started our engagement program with the nurses, and we engaged nurses through social media. We had social media flyers shared on Twitter, LinkedIn, X, which is now Twitter now, LinkedIn. We had sharing on Facebook. Also, we had individual letters to some practice nurses to share what we're doing with them. We actually went out to some hospitals, acute hospitals, to drop flyers there. And any meeting where we're invited into meetings, we share with them, because we were invited into Brent's community meeting, and we share these flyers with them. When we managed to engage some group of nurses, we put in a cooking class and a cycling classes for them as well, so that nurses can engage. And from there, that is where we got the group, the cohort of, or the core group of nurses that we're working with today. Then we had a semi-structured interview with this cohort of nurses, just to have an understanding of inequality, the understanding of inequality and how we can improve and work with the community that we deal with. So one of the community, we had various community engagement programs, which included a mental health program, talking about stress and coping strategies. Also, we looked at the blood pressure, the risk factor. We looked at hypertension, able to share with the community and answer various questions and giving them an understanding of how they can prevent all these conditions. And especially during this time that they've been finding it difficult to engage with GP surgeries, this was a good opportunity for them to share with us, and also for us to share with them and become a resource for them where they can get, and also direct them to where they can get help, and also how they can promote their own health. Then also we developed a toolkit for nurses, and this toolkit is actually to educate nurses on how to promote health. Also, it also helps nurses to support them towards revalidation, because in this toolkit, there's some educational programs there. And as you're aware, as nurses, that revalidation, you have to do X amount of hours to revalidate. So the toolkit has got some education tools there for you to use. And the link for the toolkit will be put in the chat. The link of the toolkit will be put in the chat. And the next thing we're doing tonight is the leadership webinar. And special guest for tonight will be discussing more about leadership with you. And also, this is just the flyers of the community engagement that we carried out during our program. So I will not take much of your time. I will be handing over to Vinice, who's going to be sharing with you tonight. So if you just put any questions you have in the chat. And Vinice, as I said, Vinice is the Director of Nursing and Quality, Professional and System Leadership in NHS, and also in NHS England. And she's also the Chief Nursing Officer for the Black and Minority Strategic Advisory Groups. So, Venice, thank you very much. I'll hand over to you.
Thank you so much, Lola. Can everyone hear me? Lola, can you give me a thumbs up if you can hear me?
I can, yes.
Okay, brilliant. Okay. So first of all, a really warm welcome to those of you that have joined us this evening. And a really massive, massive thank you to C3 and the staff and the leaders of this lovely organisation. Thank you for the opportunity for me to share a bit of my journey with yourselves and your audience. And so a warm welcome to those of you that are joining us live and those of you that will join us through the recording in the future. So my name is Vinice Thomas. I'm known as Vi for short, and I currently work as a Director of Nursing in NHS England in the London region. So my role covers direct commissioning, which includes specialised commissioning. It covers the nursing and midwifery element of the EDI agenda, Equality, Diversity and Inclusion agenda. It covers things such as freedom to speak up, community nursing, practice, GPNs, general practice nursing, and quality oversight for different areas. So it is a vast role, and I've been doing it for a number of years, and I absolutely love the role. Now, alongside that, I was appointed probably about 7 or 8 years ago as the regional lead for the Chief Nursing Officer, Chief Midwifery Officers, Black Ethnic Minority Strategic Advisory Group. So I'm the London lead for that group. And obviously there's a national group that reports directly to Dame Ruth May, and it advises her on issues relating to staff, patients, particularly for those from Black and Asian ethnic minority background. So what I will be doing for the next, I would say, just under half an hour is just sharing with you my journey from the time I started nursing to date. And I'll also be pulling out some of the key leadership issues that I'd like you to take away. Now, I sit on, as part of an editorial board, I sit on an editorial board for the British Journal of Healthcare Support Workers. And I've recently just completed a 5-part series on leadership skills and leadership styles. And it was quite interesting putting that work together, because one of the things I try to remind the reader about is that leaders come from all levels of an organization. So when I look back at the start of my career, some of the most influential and amazing members of staff that I worked with were actually support workers. And I think of being a first-year student nurse, and it's your first day on the ward and you're a bit nervous, and it's the healthcare assistant that would take you under their wings and show you the ropes and, you know, influence you, you know, in what you should and shouldn't do. And they were really, really quite an asset to any team, any ward. And you ignore their advice at your peril, to be fair. So in the articles I wrote, I really stressed the importance of recognizing that leadership is about influence. It's about having a vision and taking people with you to the fulfillment of that vision. And so whether you're a support worker, whether you're a chief executive, it's all about being able to collaborate, influence, motivate, and bring people with you into a better future, whatever that future is. That you can clearly articulate. So I'm going to share my screen. So as I share this with you, just bear that in mind, that leadership is about influence and making a difference. So I'm just going to share screen. Now, can you all see, can somebody just give me a thumbs up to say you can see my screen? Brilliant. So let me put this on slideshow. Right, so here is my story. So, I suppose you can tell who's me in this picture. Every time I show this picture, we chuckle. And in actual fact, a lot of my peers, when they show their pictures of when they did their nurse training back in the 1980s, it's similar, it's very, very similar situation. We were one of many. And so obviously it wasn't a very diverse group back in the 1980s. There was just myself there beaming away, looking many years younger. And then at the back, you can see the only male nurse among us, student nurse. And then there's somebody else who also is of a diverse background, but you would not be able to tell. But the lady on the far left is from Germany. So we were the three that were very, very diverse in a group of this nature. And I really loved my nurse training. I started in 1984. And to be fair, it wasn't without its challenges. So one of the things I want to say about being able to influence, I remember that I did my placement on an elderly ward, and I witnessed a nurse bullying a patient. And I was livid, absolutely livid. And this dear gentleman was in a wheelchair and he was crying. And I ran to his rescue and intervened in a way that was not appropriate. I was, in some ways, had a real kind of head-to-head argument with the nurse that I'd witnessed bullying the patient. And that was me trying to express my kind of patient advocacy, but not in the best way. And so consequently, it nearly terminated my nurse training before I even got started. And so I learned straight away that if you want to make a difference, you need to lead in a way that doesn't alienate yourself or others. And so I survived my nurse training, but that incident was to haunt me a bit later on, because in my first ever job, the charge nurse that appointed me made mention of that particular incident. And he was saying that because he knew my passion was for patients, he was saying that as a leader, if you lead wrongly, that can stay with you and take a while to go. And because he knew me, he knew that my heart was to protect patients and do the best for patients. So I learned that there's got to be a way of leading that's going to create a better future and a better outcome for everyone. And I was on the journey to really learn how to achieve that. And so I qualified, and I was really happy to be a registered general nurse. And I did my first stint on a medical ward. And as the junior member of staff on that ward, I remember being given the task that nobody really wanted to do. And it was very interesting, but I somehow was able to see opportunities that was presented to me. Maybe some people would say, oh, it's a bit of a rotten apple, but I was able to see those opportunities as an opportunity to make one of those beautiful apple tarts. I can't, you know, the French ones, I can't pronounce it in French, but pomme de tarts, is that it? I think that's how you pronounce it. But a lovely apple tart. And so every opportunity that I got, I was able to turn it around and say, actually, I can use this to make things better for patients, make things better for staff. And I remember there was somebody was asked to lead work around stroke patients. And they said, oh, Vi can do that. Let's get Vi to do it. And I could see such a need for stroke patients to be given an opportunity to meet with the multidisciplinary team after they had actually been discharged from hospital, to come back and then have opportunities to express concerns. And so I set up one of the very first stroke open evenings. So it was an open evening on the ward where all members of the multidisciplinary team came together with our previous patients and relatives, and they had a time of just sharing, learning, and it was fantastic. And I wrote that as an article. And this was back in the 1980s when these kind of initiatives were not commonplace. So that was one of the early things that I did as a nurse leader. And then, because I was very junior on the ward, they needed someone to go and to cover intensive care. There was an issue in intensive care. There was short of staff. They said, who shall we send? Oh, send Vi, she can go. So off I went down to intensive care. And to everyone's amazement, I absolutely loved it. Loved ICU and found that as like my niche. And so I specialized in critical care. So what was initially given to me as, oh, Vi can do it, she's the junior one among us, became an opportunity for me to develop a career in critical care nursing. And during that time of being a critical care nurse, this is a picture of me in one of the ICUs. But what I did do during that time, I was asked to lead on health and safety for ICU. And it was such a complicated area. It wasn't as we know it today. And so what I actually was able to do was identify an area that I could make a difference. And I realized that if something awful happened in ICU and we had to evacuate ICU, how would we do it? Nobody seemed to know. And so, cut a very long story short, with the support of colleagues and the local fire brigade, I developed an educational video called ICU Evacuate. Evacuate ICU. And that educational video was used to train our staff in how you would evacuate an ICU if there was a smoke-filled environment or some kind of issue that you had to evacuate very, very quickly. And so the other thing that I did during that time was that I led a national event around health and safety in ICU. And so again, what I was learning was that I didn't have to be the most senior member of staff to make a difference. I could make a difference wherever I was. And it was just looking for areas of needs, looking for ways in which you can improve things for patients and for staff. And it was also when, like, you've been delegated something that nobody else maybe wants to do, is looking to see what can I do to make a difference in this area. And then, having worked for a while in ICU, I left intensive care. Very, very sad to leave intensive care. But at the time, flexible working was not as commonplace as it is now. And so I left intensive care because I really didn't want to do night duty, weekends, and I really wanted to expand my leadership experience and my leadership skills. And so I was then really delighted to say that I had an opportunity to work in the nursing directorate at the hospital I was in. And working in the nursing directorate, I led on one of the largest programs for support workers. And so we basically were like the gateway to recruit those from different backgrounds. Maybe they were from the aviation industry, maybe they were from retail, but they wanted to come in to be a healthcare assistant. So my program brought them into the NHS, trained them through MVQ level 3, and then helped them to settle onto the wards, and then if they wanted to progress to being nurses. And I absolutely loved that role, because I could see those who never thought they had the potential to become nursing assistants, care assistants, support workers. I saw them come from being maybe domestics or maybe cleaners. I saw them come through, be trained, and then some of them go on to be nurses, registered nurses. And I remember one of them saying to me, I bumped into one of them on the train, and they said to me that every time they did their nurse training and they wanted to give up, they thought, oh, we better not. Sister Thomas wouldn't be pleased with us. We've got to make Sister Thomas proud. And so I really enjoyed my time there. And again, it was somebody who was able to lead and make a difference behind the scenes. And I think as a leader, you don't always have to be the one that everyone can see. You can kind of be leading very subtly behind the scenes, because really you're actually sowing seeds that will reap a harvest in the years to come. So that's the key thing. So I left that role and I had an opportunity to go into a commissioning role and became an assistant director of nursing. And I say it was the unthinkable because, to be honest with you, when I started my nurse training in 1984, I had no idea that I'd ever become an ADN. No idea. I didn't have a mapped out career plan at all. So all of this were things that kind of somehow, by leading and seeing opportunities, I was able to make the most of these opportunities. So I became an assistant director of nursing, and in some ways, it was a real stretch for me, because I then had departments I had never ever led before. And in some ways, I then learned the importance of mentorship and coaching and networks. And during that time, I started my MBA, and I was in a class with a fantastic woman called Mary Clark. And Mary Clark became my mentor for a number of years. And at the time, Mary Clark was the chair of the Chief Nursing Officer for England's Strategic Advisory Group for Black and Asian ethnic minority staff. So Mary took me under her wings, and she helped me to join that group. And that group became a support network for me. And if I didn't understand something in a department that I was leading, I asked Mary, or I was able to call upon the networks. So when you look at being a person of colour and how you can really be influential and develop your leadership skills, it is about making sure that you have a strong mentor, a strong network around you, and you have access to a coach. So my time as the Assistant Director of Nursing for that organisation came to an end in that one day the chief nurse at the time, she was asked to lead on infection prevention and control, what we call the DIPSI role, Director of Infection Prevention and Control. And she said, oh, Vi, I don't have much time to do this. She was looking around and thinking, oh, let's get Vi to do it. Vi, you can lead, you can be the DIPSI for the organisation. And I thought, well, fair enough. I didn't know what I was doing. So you had to read up, you had to then make the contacts. And what then came out of it was I enjoyed being the DIPSI. I enjoyed helping to set targets for the providers that we oversaw. And then from that role came the opportunity to work in the Department of Health as part of a national team. And so I was able to work across in a national team in a role supporting providers in terms of achieving their MRSA and their C. diff targets at a time that no one would believe that we can reduce MRSA bacteremias by 50%. But we did. As a nation, we did do it. And I was part of the team to support that achievement. And what came out of that opportunity was I was able to edit a book called The Fundamentals of Infection Prevention and Control. And that was a huge opportunity that came about by chance. And again, time won't allow me to tell you how that happened, but it was really quite a strange divine opportunity is what we would call it. But we were able to produce this book, and it was also published in Polish as well. It's still out there for sale, and I really enjoyed bringing together infection prevention and control leaders. The interesting thing, though, about a leader is that I was not an infection prevention and control expert. I understood it from a board level point of view, but not the, all of the technicalities and the detail of it. But I was able to bring people together and together produce a resource that was really useful. Around that time, I then joined working supporting the editorial board for the British Journal of Support Workers. And then that was an article that I did about looking back to the year that has gone and saying to yourself, have I done it right? How did I do? And that was just an example of what we did there. Then my time at the Department of Health came to an end. And I think it was around the time of the coalition government, and all of us that were secondees were sent back to our organisations. And what then came up for me was quite extraordinary. The King's Fund at that time was looking for a programme manager stroke a quality improvement lead for one of their programmes. At the time, it was a programme called Safer Births. And I had, again, maternity and midwifery is not my speciality, but I was able to use my leadership skills and take the opportunity to be part of that team. And what came out of it, I was able to produce a toolkit for maternity services with Anna Dixon, who's an amazing leader in her field. And so I suppose when you look at my journey so far, a lot of it was looking at opportunities, how can I make a difference, and not shying away. And it hasn't all been straightforward because it has been bumpy along the way. This is just a picture of myself with Celia, who's from the Royal College of Nursing. And the reason why I like this picture was she was one of the first ever, I actually think she was the first president of the RCN. And it was at a time that I had joined one of the RCN steering committees. And I'd been part of their education steering committee for the education forum. And then a bit later on, I was on their steering committee for the leaders in management, nurse leaders in management. And it was really, again, an opportunity to expand my leadership experience and to identify what can I do to support nurses to make a difference ultimately for patients. And then I had an opportunity to reflect and go back to where I first trained. And this is just me reminiscing back where it all began, and to really see how sadly some of the places that I trained had actually closed down. And I think as a leader, you do need to know when to move on, when to celebrate the past, but not to stay there, and to look at how you can continue to build and keep yourself developing and stretched and motivated. And that's what I've tried to do. So when I look back at my journey, one of the things I will say is that there's been some ditches. I know some of my colleagues, when they give a similar talk, they speak about the mountain tops and the valleys. And my career has had different valleys. So I know what it's like to be discriminated against at an interview. I remember one of the jobs I went for on my journey. I really, really loved the department. I loved the organization. And at interview, I was told that I was the best performing candidate, but the lady that was the appointing officer just didn't want me. She wanted a colleague who she felt fitted better with the team. Even though the rest of the panel said, "You're making a mistake. Vi has a good track record. She's solid. She'll be a safe pair of hands." But unfortunately, I was denied that opportunity. And I didn't realize this had happened until I began to ask more questions. And I must say, I was really heartbroken. I was heartbroken because I felt that I didn't know why I was discriminated against at the time. And sadly, what then happened, the person they gave the job to, she became unwell and she was never able to continue. She left the job due to stress, work-related stress. And so in many areas, it was a really sad time for all of us. And so some of the other kind of valley moments was when I was ganged up by a whole group of staff. I'd gone to work in a particular part of the country and was told categorically, "We don't take well to outsiders here," and was ganged up in the most horrible way. And it was when I really learnt the importance of having a strong network of people that can hold you up, keep you going. I'm a woman of faith. I've got a very strong Christian faith. And I know my Christian faith, as well as my colleagues in the SARG, the CNOBME SARG, they were all really helpful to help me through some of those really deep, lonely valley moments. Then I came to work in NHS England in London. And I must say, when you find a job you love, I just think, I don't believe in jumping around for no reason, to be honest. I've got to check the time. Have I got a few more minutes? Lola, have I still got a few more minutes? Okay. I really don't believe in jumping around for no reason. And I have absolutely loved working for NHS England, for the London region. I've loved it. And one of the reasons is because it's enabled me to be creative. My line manager is Jane Clegg. She's the Chief Nursing Officer for London. And one of the things that I was able to do when I was appointed to be the London rep for the CNO-CMIDO Strategic Advisory Group, I introduced a program called the Talent Management Support Network. And it brought together nurses from all different backgrounds, nurses and midwives. And we put them in little kind of safety hubs. And these safety hubs were action learning sets where they were able to share their concerns, to share the issues that were blocking them for really reaching their potential as leaders. And what you see here is a snippet of a cohort that we launched in Brazil. And that in itself is a completely another different story, but it was such an experience. And I have written a bit about it in an article that was published called How to Set Up Your Own Talent Management Support Network. And I talk the reader through step by step how we did it. But when we launched in Brazil, it came about because somebody that was on the program was so changed by it that she went back to Brazil, told them about the program, and they said, oh, do you think Vi will help us do something here? And it was a privilege to be able to support some of the healthcare workers in Brazil, southern Brazil, and helping them in some of their challenges in their careers, and to be stronger nurse leaders. And so we had an article in the Nursing Times where we featured some of the work that we were doing to support ethnic minority nurses and midwives, and looking at how we can make them feel more valued and reach their potential. And this was just a feature article that was done in the Nursing Times. And one of the things I will say, there's a saying that says it takes a village to bring up a child. And I would say that no leader survives by themselves. You know, I would say, I know many people wouldn't believe me, but I'm a bit shy. You know, some people say, oh, stop it, you're not. But I tend to be shy and quite, you know, slightly introvert at times. But I recognize the importance of having a leadership, you know, having people around you to work collaboratively, all type of people, different backgrounds, different races, different personalities, because only together can we make a difference. And that's what my journey has really been about. My last two slides takes us to really where we are now. This is me in one of the Houses of Commons lecture rooms or conference rooms. And every nurse and midwife, at some point in your career, there will be that one patient that really breaks your heart, that keeps you up at night, and that you desperately want to make a difference even more for that patient. And mine was a young gentleman, Evan Smith. And I remember being at home watching the television, and the news came on, and Evan Smith was admitted into one of our hospitals, and he dialed 999 from his hospital bed. He was in a sickle cell crisis, and he needed, I think it was oxygen, or he needed painkillers, and he didn't feel the staff were helping him, and he dialed 999, and sadly he died. And I've never, I mean, of all the things that I've been through in my career, you know, all the deaths that I'd kind of witnessed and the bereaved relatives that I'd supported, nothing had moved me as much as this case. I was so upset about it. And what I did was I began to look even closer at the whole issue of health inequalities and inequalities in outcomes and in experience. And I thought, why is this happening? And so what I did was, because I cover direct commissioning, myself with the ICB and my team, we were able to put on different events to look at what happened and what's going on with sickle cell patients and how can we improve their experience. And so this piece of work, we actually did a listening event, a response to the all-party parliamentary report, No One Is Listening. We did a response to that. And we started off a series of quality improvement initiatives to address areas of the sickle cell patient care and pathway. And one of the things that I came up with was, one of the clinicians said, I think we need an acronym so that if a patient's got a sickle cell crisis and goes to any A&E, the staff know exactly what to do, even if they're not familiar with sickle cell patients in a crisis. So I just one day said, well, what about something like ACT NOW? And began to spell out A for, you know, analgesia, C for compassion. You know, I began to spell out the acronym. And what I'm delighted to share with you, again, as leaders, you never know when your idea or your ability to lead is going to have an impact. But that simple idea of the acronym ACT NOW is actually being run with. So one of my colleagues, Kathy Brennan, she's leading a team in helping us to pilot the acronym ACT NOW for those that are in sickle cell crisis. And it's been piloted in different hospitals across the country. And it's a huge amount of work, but it is to improve the experience of patients with sickle cell in a sickle cell crisis. The reason why I kind of wanted to, in some ways, bring us to that point is that ultimately that's what is important to me, and I'm sure to you as leaders, is to make a difference for patients, for our communities, for our population, and making sure that all of us come together, not just those that are not BME in senior positions, but we want everybody who has that potential, regardless of race, gender, creed, regardless of these things. We want as many people to reach their potential for the betterment of care for patients and for relatives and the population. And so as I come to an end, the final thing that I would say, which always makes me chuckle a bit, was as well as doing all these kind of initiatives to help improve care for patients and relatives, I wrote my first ever children's book. And that's me getting so excited when it first arrived, and there in my hand was Rebecca and the Strangest Garden, and I couldn't believe it. And so again, as leaders, we influence not just our teams, not just our departments or our hospitals, not just our local population, but why not influence globally? Why not look beyond, our nation to make a difference for the next generation of leaders? And so I'm going to stop there. I believe that's my last slide. I just thank you for the opportunity just to have a bit of a canter through my journey to date. And I'm really happy to take any questions. And I'm going to stop sharing and hand back to Lola. Thank you.
Thank you very much, Vi. Can I just take this opportunity to call the next speaker? Then after that, we can answer so many questions. So I've got a draft of what Vi presented tonight, but so that we don't take enough time with questioning, I'll ask Lelia Khan. Lelia Khan is the mental health practitioner who was also involved in the community engagement. She's just going to share with us her reflection on her community engagement and how she felt. So Leila, can I hand over to you, please?
Lola, yes, thank you for the opportunity. Are you able to share my slides, please?
Okay, give me 1 second.
Thank you.
Hold on, let me just exit this one. Sharing. Give me 1 second. Yes, I found it. So slideshow. Okay, is that okay?
Yeah, that's brilliant. Thank you, Lola, and thank you so much, Vinice. That what a wonderful journey you've been on, and very honest as well, talking about the highs and the lows. I love the idea of the ditches. Yeah, and I'm sure you're going to have loads of questions. So yes, just a little bit about me and my connection with C3 Healthier Communities. My name is Leela. I'm a registered mental health nurse. I work for West London Trust. I've been qualified for 10 years now, and I'm now working as an associate practice development nurse. So I'm no longer clinical, but I am supporting nurses, students, preceptorships, healthcare assistants as well. A bit similar to you, Vinice. It's so amazing to be able to develop and support the next generation of nurses and nurse leaders. I'm also a batch flower practitioner, and not many people know about that, but I'm very interested in not just because I work in secondary mental health care. I'm very interested, possibly like many of the nurses on the call now, interested in public health and also preventative health as well. So that's where my interest in complementary remedies and therapies has taken me. I'm also a big advocate of coaching and mentoring, and I'm a trained health and wellbeing coach. And I think it's a fantastic opportunity to be able to coach others and be coached yourself. You also mentioned that, Vinice, in your journey. And I'm passionate about all things mental health. So I have put on workshops, one of them that I'll talk about in a bit more detail. Lola, next slide, please. Thank you. So C3, I met Lola and Michaela and David last summer when they were putting on some healthy cooking workshops for nurses, for BAME nurses. And it was such a wonderful opportunity. And because I met Michaela, Lola and David, they asked me to lead a community workshop on mental well-being to a group of Afro-Caribbean parents at a Saturday school in North London. And together it was only supposed to be an hour, you know, very briefly sort of scratching the surface of mental health and well-being. So we decided that I would lead a session on stress and the impact of stress, the stress obviously of post-pandemic, also the cost of living crisis, and just generally, you know, in terms of what's going on globally in the world. So we looked at stress. The idea was to look at stress, the impact of stress, how it impacts on people physically, mentally, emotionally, but most importantly, what we can do about it. Okay, next slide for me, please, Lola. Just as an example, we talked about, and it generated so much discussion actually, about we've all got used to, particularly nurses, living with stress. And it's very interesting how people have become very used to palpitations, breathlessness, feeling chest tightness, digestive changes as well, headachy, aching limbs, tiredness, fatigue. Next slide, please, Lola. And obviously, in that first session, with such an engaging community group, we didn't get through half of the slides that I wanted to get through. So I was asked to come back after Christmas to finish off, actually. But actually, the group was so engaging, and they had so many ideas. They knew the kinds of stressors that were having impact on themselves and their families. So actually, in the second workshop, we chose to focus on things that cause stress. The idea that chronic stress, that actually we shouldn't ignore it, because stress itself can lead to burnout. We shared practical self-help tips and advice to try and impact the stress of on ourselves and others, because stress kills. There's no other way. We have to manage and find a way of dealing with stress in our lives. Lola, next slide for me, please. Thank you. So again, an example of one of the things that we looked at, and again, I didn't even get a chance to go through all of the slides because the group was so engaging. But in order to minimize stress, in order to prevent that stress from becoming chronic and leading to burnout, which is affecting many of our members at the moment, we talked about being assertive, about being aware of boundaries and learning to say no, and having the confidence to say that as well. And that we shouldn't just live to work, or sorry, we shouldn't just work to live, but you know, have variety and outside interests as well in our lives. We talked about priorities and life goals, and I think Vinice might agree with me that coaching and coaches are very helpful in terms of identifying life goals. Reviewing that very precarious work-life balance, which you know a lot of us do struggle with, time management as well, and also learning to become aware when we might be becoming stressed in ourselves, and when others around us, colleagues, families, our communities, and what we can do to minimize that. So thank you for listening to me, and yeah, thank you, Lola. Thank you and C3 for the opportunity.
Lola, you're on mute. It's always the phrase, isn't it?
Yes.
We're all used to that phrase.
Yes. Thank you. Thank you very much, Leila, for the presentation. Now, before we go into questioning, I'm just going to give a brief overview of what I've heard Vi spoke about. She spoke about leadership, and she said leadership comes from all levels in the health sector. So we got to remember that, and also that we need to influence vision. We need to have a vision and take people along to a better future. We need to make a difference. We need to look for areas of need within our place of work, and we can lead behind the scenes. We don't have to be in front, we can lead from behind the scenes. And she spoke about the importance of networking, coaching, and mentoring. And also that we need to look for opportunities. There is opportunities in the NHS, in anywhere we work as a healthcare professional. There is always opportunities, and we need to look for it. Then Leila spoke about she gave a feedback about her work with the community, the engagement with the community, and how she discussed with them about the impact of stress on our physical and our mental health, and also the ability for us as individuals to be able to manage our time and also work-life balance. So what I'm going to do now, I'm going to throw it out to everybody to ask questions. So I'm sure there are loads of questions in the chat. And also, if you want to use the reaction to raise your hands, that would be great. Thank you very much.
And we do have a lovely comment and question from Melissa in the chat that I think would be great to pick up, if that's all right with you, Vinny.
Thank you. Thank you, Melissa, for lovely feedback and for your question. So just for everyone else, it says, did you ever feel unsure or hesitant following your personal values and desire to make a difference despite the lack of expertise in your leadership journey? And if so, how did you overcome that and turn it into a vital stepping stone? Yes, I did. I've often felt unsure and hesitant. You know, sometimes when you're a leader, you are kind of stepping out in faith. You're putting your head above. And, you know, there is so much risks that sometimes associated with that. But I always believe that you've got to be very clear about your own personal values, and you've got to be clear about the line. You know, we all have like a moral compass. We've got a line that, you know, you won't cross or you won't allow to be crossed. And so I think it's being true to who you are. And I'm pleased that you mentioned something about authentically leading authentically. And so what I would say is that it is normal and natural to feel unsure or hesitant, but that should never stop us from following our desire to make a difference. And I would definitely not ever advocate anybody compromising on their personal values. So in order to overcome some of the anxiety or the kind of apprehension that you will feel at times, I think it's important to have that person who is your mentor. Somebody described mentors as somebody who's made the mistake so that you don't have to make them. And so I would say that having somebody who's a mentor or a sounding board that can be trusted, a safe pair of ears, is one of the things that helped me to talk through some of my options and some of my intentions. And sometimes they would sense check it. And also, you know, we come into these senior roles not knowing everything. We categorically don't have all the answers. I was asked to lead on something to do with equality and diversity, an act that I had no experience of at all. And that's where you need to draw on the experts, and you need to make the networks and the connections, and you need to be humble enough to say to people, can you show me, can you teach me? And I think, you know, there was a saying that those of you that want to be a leader need to be the servant of them all. So I think that kind of teachability and humility has always got to be at the heart of a leader. So thank you, Melissa, for that lovely question. I hope I've answered it.
You've answered it really well. Thank you so much. I feel so inspired. Thank you.
Thank you, Melissa.
I have a question. And my question is just about a nurse trying to develop herself to become a leader. And every time she makes an effort, she gets pushed back. How can a nurse like that deal with that sort of situation, where she gets pulled back from senior managers who say, no, we don't want that, we're not interested in that. And maybe later down the line, one of them comes up with that same idea that you brought forward. How do you deal with situations like that?
You know, so there's two things. If it's an idea that's being pushed back, there's something about lobbying. And years ago, I did a course at the RCN about political leadership. And they said that if you've got something that you want to push through, then you need to look at your stakeholders. You need to look at who are the influential people, who do people listen to, who do people, you know, who have got somebody's ear, who's got the ear of those in power, and you can lobby through that person. So in the past, there's been ideas that I've had that, to be fair, on the surface are completely off the wall. But you then need to find somebody who be your ally, who will then present that or support that for you. Okay, so that's how I would say to somebody who keeps being pushed back, don't lose heart. Maybe it's the timing's not right. Find an ally and do lobbying with the ally. Suggest things such as piloting, you know, can we pilot it for 3 months and see if it works? Be prepared to see if maybe we can kind of modify it and create a win-win. So there's ways to navigate around it, but don't lose heart. And particularly if somebody then does it a few months later, you know, I've been through that on 2 major occasions when I've had a brilliant idea, couldn't get it through, and then somebody else got it through and it's exploded into success. And you think, crying out loud, that was my idea. But, you know, you take it on the chin because another idea will come, but you learn from it and you pick yourself up and you keep soldiering on. You're on mute, you know, Lola.
Thank you. I'll leave the floor for any other question, but if there is nothing, I've got another question that I'd like to ask. So I just want some other people to ask questions before I ask my next question.
Lola, I've got a question for Vinice.
Yeah.
Vinice, you talked a lot about leadership and about building strong networks and connections as well. Yeah, I'm trying not to make this 2 questions. Let me ask my first question first then. What are the most important leadership skills do you feel that where can we acquire those? How do we develop them? And in your long and illustrious career as well, what leadership skills have stood you in good stead?
Okay, so the first question is, how do we develop the leadership skills? Yeah, and then the
Yes.
second one is, what leadership skills has, okay. So I think, how do we develop them? I would say two things. The first one is to look for strong role models. So I look back over my career and I think, my gosh, there were some fantastic role models that I looked up to, and I thought, my God, I'd love to be, when I grow up, I want to be like you, that kind of thing. But it's looking at the good role models, but being aware of the bad ones as well, to say, I will definitely not lead like that. So it's looking at those that are ahead of you in the game and looking at particularly the good role models. What are they doing? What can I learn from them? And also trying to get close up to them, be it like as them being your mentor or your coach. The other thing is taking every opportunity you have to lead. So if somebody says, oh, we need somebody to organize the staff the Christmas dinner, who wants to do that? But by doing it, what you're doing is you're building relationships, you're learning what it's like to manage the budget, to manage the difficult conversations. So it's looking at all these opportunities to lead that come your way. And it's also sometimes creating opportunities. So seeing a need and saying to your line manager, oh, I see that we need this. Do you mind if I do something to support it? So it's the role models, the creating opportunities, and the making the most of the opportunities that come your way. And that's how I would lead. Some people would say, go and do a leadership course. Yes, you can do leadership courses, but I think it's like just reading about the theory of driving and never getting behind the wheel of a car. So that's why I would say, try and do leadership. Now, the leadership skills, I think the most important one has got to be interpersonal skills. You have really got to get on with people, even when they're challenging. You've got to be able to create a win-win situation and communicate in a way that doesn't alienate anyone. Because I think a leader is not a leader unless they've got people to follow them. And if you cannot communicate, you cannot build relationships, and you cannot value what people can bring to the table of your life or the table of your project, whatever it is, then you can't really lead. So to me, I think the most important one is the ability to collaborate and to have good relationships with people. Not everyone will like you as a leader, and that's the hard thing, is when you try your best and people do not like you. They don't like you because you're black. They don't like you because you're female. They don't like you because of your religion. They don't like you for something. It really does hurt. But the reality is, not everybody is bad. Not everyone's going to dislike you. So it's really running with those who you can run with, and not writing off those that don't like you, but not being traumatized by them. Put them on the back burner, because one day they may come into your favor in due course.
Thank you, Vinice. Fantastic answers there, as I knew you would. Thank you for that. Thank you for sharing your insights.
Thank you.
There is another question in the chat to both Vinice and Leila.
I'll get you to do that, Leila.
I think you've kind of almost answered it, Vinice. When you talked about the importance of interpersonal skills, and building relationships, I think, you know, as nurses, we are communicators. We are skilled communicators, and also we should be skilled listeners as well. And I think, you know, listening is a very underrated interpersonal skill. It takes a lot of time and patience to get it right. And yet, you know, you always see on someone's application or on someone's CV that they will write that they're good listeners. And I think to be a good listener, it kind of encompasses all of those communication skills, the ones that Vinice was talking about, and also emotional intelligence as well. You know, as Vinice was saying, we're not gonna be everybody's friend, and we're not there to be everybody's friend. And I think as women particularly, it's really hard, this kind of people pleasing, or not feeling that you're good enough, or this idea of imposter syndrome. I think it's very real. So I do feel that, you know, conflict is something that I struggle with and have done personally and professionally. Yeah, because it's this need to be liked. But I think it goes back to what Vinice was saying about knowing your moral compass and having a strong sense of values, knowing who you are. That self-awareness that comes from the emotional intelligence will help you to deal with people who don't share your values, who don't see the world the same way that you do. And that we won't always be blown off course as well. You know, Vinice talked very eloquently about the highs and the lows. You know, but being professional and having professional and personal values and thinking about those and thinking about who we are and what kind of nurse leader that we want to be as well. I really like that idea, Vinice, of having good role models, people that we aspire to, but also the bad role models as well. They're the ones, you know, they're definitely not the nurses that we want to become. Yeah, so I think every day is a learning opportunity. And what I would say is brush up on your communication skills, because we can all become better communicators, better listeners. Yeah, and then we will be the role models that other nurses, junior nurses, will look to. I hope I've answered the question. It's a kind of a rambling, but yeah, you're very hard to come after you, Vinice, because you've got the expertise and the skills.
But so have you, Leila, for sure. And I think your response is fantastic. The question, it says also, though, in the moment, and I just don't know about you, Leila, but I think when you're presented with somebody who in some ways is quite verbally aggressive, or the conflict is right there in front of you, in that moment, what on earth do you do? And, you know, I actually think there is no shame in walking away, or no shame in saying to somebody, you know, I feel that you're cross, and so I think let's just end the conversation and come back when, you know, we're both probably feeling a bit in a different place. There's no shame in walking away from conflict. And, you know, there's a saying that says even a fool is considered wise when they hold their tongue. And there was one relationship that I destroyed because in the moment I responded, and I should just have said, you know what, let's terminate the conversation for the time being. Let's regroup in about half an hour, because you just need a quick coffee break or quick fresh air just to get your thoughts together and then to come back. So the person who's put that in, I would say in the moment, don't retaliate, because once you've said it and done it, it's hard to take it back. I think there is no shame, or you won't be, no one should think bad of anyone that walks away from conflict, and then come back when you're in a better, you know, you feel a bit more kind of in control or a bit more comfortable, and then talk it through in a reasonable way. So that's a really good question, Hester. Really good question.
I think you're absolutely right, Vinice. There is no shame in walking away, and actually it means that you're the bigger person to do that rather than reacting in anger. Yeah, it's
okay.
I think having that pause and just walking away is emotionally mature. Yeah, it's the best advice, you know, the stop, the pause, and then come back. Brilliant, brilliant, love it.
Thank you very much. Thank you both. There's another question here. How can we help nurses to blossom with leadership within their roles and profession, rather than feeling only to be a leader in a leadership role?
You know, I think one of the saddest things is for us to lose clinical nurses who think that in order to be leaders, they need to become nurse managers or, you know, which is why the nurse consultant role was developed. Do you remember that? That was to keep clinical nurses in the clinical areas as clinical leaders. So we do need the clinical leaders. And from what I understand, in some areas, they're trying to revive that nurse consultant role. So I don't think any nurse should feel that they've got to leave the bedside in order to become a leader, because they're leaders. Though, as we've said before, they're leaders at different areas and different contexts. So I think we probably need to look at how we can make nurses feel more valued, regardless of their role and regardless of what they're doing. We need to find a way of making them feel more valued, and some of that is really them also showcasing what they're doing in all the different areas, because sometimes the wider organization or the wider profession really doesn't kind of see all that good work that's taking place right at the heart of the patient environment, if that makes sense. What do you think, Leila?
Can I add more to that? Because I want to add more to that, because I'm a clinician and I work from a clinical basis, work myself to a leader and a manager, managing my service. Even though I've retired, I still work and I manage a service I'm working within at the moment. And I'm still hands-on clinical, but I still manage the service. So as a nurse, you don't have to leave the clinical before you become a manager. And I'm a chartered manager, but I still manage the service. And just to let everybody know that it's not just working a way to become a manager or a leader in a senior position. Even though it's still a senior role, but I'm clinical and I'm still managing a service.
And it's to help nurses to blossom.
Yeah.
Something blossoms when it's watered and fed. So we do need to make sure that nurses that have stayed, within that clinical environment, we need to really make sure that they do feel protected, supported. There's so much that's going on at the moment. When you look at COVID, you look at industrial action, you look at the backlog of waiting lists, all of the recovery from COVID, all of the financial crisis, and the nurses and the midwives at the very forefront of care or services still have to keep going. And so it's really important for us to make sure that they feel valued and that they feel nurtured and that they get the training and whatever they need to really grow in those roles.
Yes, I agree. I agree, Vinice. I think we're not valued by the public. The public who put us up on a pedestal during COVID. People have very short memories, and particularly in terms of, as you were saying, blossoming, nurturing, self-care. We need to really get better at looking after our own physical and mental well-being, because we're on the front line. We're the ones who are delivering that care to other people. Where are we going to find that nurturing and that blossoming ourselves? There are too many cases of nurses who are suffering fatigue, who are suffering burnout. Compassion fatigue is a real thing. we really do have to. I think, you know, COVID has shown us we can't take our health and our well-being for granted anymore. We really do need to look after ourselves, and that means taking our breaks, you know, making sure that we get enough sleep, that we deal with relationship issues or whatever it is, whatever's causing us stress in our life. You know, there are counseling services for us. We as nurses, and you know, doctors as well, we don't you know, we just don't take advantage of the employee assistance and the Oki Health counseling services that are available. You know, as you said, Vinice, that there is no shame. It's not about shame anymore. It's about looking after ourselves and valuing ourselves as well.
I think you're so right, Leila. Absolutely right. And I think, you know, as annoying as this may sound to some people, I sometimes think that those that are in more senior leadership positions, we cannot think that we've got all of the answers, because what will be helpful to relieve the anxiety or stress or to make one group of staff blossom may not be the same for the other group of staff. So I always think that it's important for staff to articulate clearly, what do you need to help you in your role to blossom. I know they can say we need more staff, or we need, you know, the patients are really sick, so we need more equipment or whatever. But I think they might, you know, I think it would be helpful for them to be really clear. An example is somebody said we need the senior managers to come and relieve us for our breaks, so that we can all have maybe, you know, maybe an hour of downtime. Those kind of suggestions, I think, needs to kind of be articulated, so that senior managers will know practically what else can we do, what will make a difference for you in your shift or in your role. And I don't think senior leaders can assume we know, because we really won't know the fullness of what can help. Yeah.
Thank you very much, Vinice, for a wonderful evening. Thank you for sharing your experience, your journey with us. There is a lot to take home tonight, and we really appreciate that. Leila, we appreciate you. Thank you very much for your continuous support. It's been a super evening, and I really appreciate it. Thank you very much. And for all the participants, thank you very much for being here tonight. And also, there is evaluation form, so don't forget, before you log off, kindly fill the evaluation for us. We appreciate your feedback. Thank you very much. And if there is no other question or feedback, we'll say have a wonderful evening and enjoy the rest of the week.